Hello, sweet parents. Welcome to the When Our Adult Children Walk Away podcast. My name is Dr. Janet Steinkamp, and during each episode of When Our Adult Children Walk Away, I will provide my professional and personal insights, information and opportunities for your self-reflection and growth, tips and tricks to make every day count, and encouragement to keep moving forward. I'm here to help you dig deep and get down to the root causes so that you can find your way out of the darkness to a positive and lasting relationship. Grab your notebook and a pen, settle into your favorite chair, and let's get to it. In this episode, we are digging a little bit deeper into the differences between therapy and coaching in estrangement. People have a difficult time sorting those two out, and frankly, I think providers do too often. We see people sort of get into each other's lanes and trip over each other here and there. And really, there are some areas of overlap. And we should say to begin with that therapists, licensed therapists, and that's what I refer to here, I don't advise working with folks who are not licensed. And that is because we know there's oversight. There's an accreditation body, there's a licensing body, there's somebody monitoring and maintaining a level of quality care. So therapists are really trained to diagnose. They focus on mental health, underlying emotional situations or conditions. They focus on trauma-related factors. What kinds of things might have happened in somebody's childhood that might be contributing to their current state of emotional health. They focus on assessing things like depression, anxiety, unresolved trauma, family dysfunction. They work with a publication called the DSM. It's a diagnostic manual that the insurance companies all agree to, the healthcare systems agree to, and it's followed consistently to ensure a level of quality care. It looks at symptoms, duration, intensity, and when the therapist puts all that information together, they determine a diagnosis. The diagnosis then is insured or not insured by an insurance company based on what the psychological community establishes as a basic timeline for care. So if it's chronic depression, you may be approved for X number of sessions. If it's situational depression, the insurance company may say, no, that's a different number of sessions that we think will be necessary to help this person with their circumstances. Now, in coaching, there's no insurance. There are, on occasion, employee assistance programs that will reimburse clients for coaching, and there are HSA programs that will reimburse. So there are still ways, on occasion, to get assistance with the cost of coaching. So therapists focus on diagnosis and mental health. They focus on psychological healing. Their service is therapeutic in that it focuses on understanding and processing past events, maybe childhood experiences, grief, trauma. And for somebody going through estrangement, therapy would potentially uncover relationship, things that contributed to a fractured relationship. And that's that family dysfunction that we talk about. Therapists help the person find ways to heal emotional wounds. That way, they can help a person increase their mental well-being. So therapists do deep emotional work. You might hear terms like cognitive behavioral therapy, EMDR, psychodynamic therapy, trauma-informed therapy. They really try to they should create a safe space for people to process their emotional baggage, emotional, like unfinished business, and be able to move through those things in a controlled and intentional manner. So it's not just chaos and crisis. That is that long-term deep emotional work. Number 4 is about the length of time that the therapeutic relationship exists. I mentioned just a minute ago that the insurance companies really dictate the number of sessions that a therapist has covered to treat a specific diagnosis. So some diagnoses really require a long-term relationship, weeks and weeks and weeks. Some people are in therapy for years, and some diagnoses require only a few sessions. The important thing to note here related to estrangement is that the number of sessions a therapist can see a person has nothing to do with the relationship in the sense of perhaps a reconciliation. Therapy doesn't end because you've reconciled. Coaching, on the other hand, is much more related to the duration and the circumstances of the estrangement. Therapy is determined by the diagnoses. And then number 5, the characteristics of therapists or of therapy is that therapists work in a clinical framework. So 50-minute hours. Once the diagnosis is made, then they start creating a treatment plan, and then they work with the client to move through that therapy plan. There are benchmarks and various measurements that the insurance company will require for treatment. Very different than estrangement coaching. Coaching, specific to coaching, is very goal-oriented. We use action plans. We have tangible outcomes. We do goal setting. We really look at what you can see and describe and feel. We look at strategies for reconciliation. We do a lot of boundary settings. Anybody who's worked with me knows we talk a lot about boundaries. We focus on your personal growth and moving forward in the relationship. Moving forward with purpose. Moving forward with self-acceptance, self-accountability, pride. We want you to get to a place of comfort and self-acceptance. Number 2 for coaches is that it's non-clinical. We don't diagnose. We don't look for mental health conditions. We don't treat psychological issues. If we identify them, we may refer to a therapist. We may encourage the person to seek therapy. We may offer to talk with a therapist that is already working with a person so we can coordinate our efforts and make sure we're not working in ways that are counterproductive. Coaches focus on building strengths and skills, so that's the communication training. We talk about empowerment, emotional resilience. We really look at each individual and offer advice on how to approach difficult conversations. There's a book called Crucial Conversations. It's wonderful. I believe it's on my website, whenourdultchildrenwalkaway.com, so take a look out there. And then number 4 for coaching is short-term, solution-focused work. We do not, as coaches, anticipate that we're going to coach for months and months or years. I may see a person 1 or 2 times, and then we don't see each other for weeks, months. And then when something comes up again that they need some assistance navigating, then they get back in touch and we work together again. Where therapy is very prescribed in how often and the duration that they can see people, coaching is not. Coaching is very situationally tethered. So number 5 in coaching is empowerment and accountability. We really encourage personal accountability. What does that mean? Personal accountability, that we own what we did. We own our stuff. We take responsibility for our contributions. Yep, I get really sharp and laser focused. And anybody who's not comfortable with that, my dad used to say, Janet, you just go right over the top of people. And he's not wrong. When I'm on point and I'm focused on a task and getting things done, I'm on it. Like I'm a workhorse. I get it done. I'm not a touchy-feely person in those moments. I certainly have an empathetic and compassionate side of me. Absolutely, no question. It just depends on what the situation is. So I know in those moments when I'm laser focused, I need to remember to look around and see if I'm mowing anybody over. That's the difference between therapy and coaching. So just to summarize it, therapists work to heal emotional wounds. They're often looking at underlying trauma and psychological issues that might be contributing to the estrangement. Coaches are really looking at practical steps, personal empowerment. We look at helping clients set goals that are related to estrangement and perhaps peripheral to the estrangement, but that will support the person in becoming independent and self-sufficient and separate from the adult child, but in a relationship. If you are working with a therapist, you may still want to seek out a coach. A therapist who's also trying to do coaching, unless they're trained and licensed in both areas, they're out of their scope of practice. You can do better than that. And a therapist who's good at what they do will not be offended by a person saying, I really think that the work we're doing here would be complemented by having a coach. I'm going to see what kind of coaching services are out there, and you can anticipate a well-trained professional therapist will respond with something like, "What a great idea. Let me know what you find. Here, I have some names you might consider." They won't be threatened. It won't be competition. It will be a value plus service. So I appreciate you joining me here today to talk about this and to learn a little bit about the difference in therapy and coaching. That is a question I receive in almost every initial meeting, and it's good to clarify on the front end. So I'm hoping that this might give you a little tutorial on the two and what you're looking for or what you need and who to look for maybe. So remember on the website, When Our Adult Children Walk Away, there's a list of resources. There's no obligation. It's just I know that these are vetted, professional, reliable, safe resources. So quick note about a couple things that we have going on in our work When Our Adult Children Walk Away. The first is that we've opened up a YouTube channel where I'm posting interviews with various people related to estrangement. Right now there's an interview up with an author of a book related to estrangement and overly dependent adult children, how we raise them, how we contribute to that, and how we give them space and still maintain a relationship. Meredith Gordon, she's wonderful. It's a great interview. The other interview is with Christy Ward. She works with the DISC, which if you've looked at my website is a tool that I use in communication to help people understand how they communicate, how they're perceived, what their intention is versus, how it lands. So very interesting conversation with Christy. She also, by the way, has been estranged from different children for different lengths of time, one for 25 years, one off and on for shorter periods of time, but at different times throughout their life. So very interesting story and conversation with Christy. I really appreciate both of these people and the time that they spent with me. I'm going to expand those interviews to include adult children, reconciled adult children, parents who have reconciled, and then medical professionals and all sorts of different folks who work related to estrangement. So check in on those interviews. And then we've started a small conversation group for parents on our Facebook page. This is a private group, and we are asking people to fill out 3 questions so we can know a little bit about what you're looking for to make sure what we're offering and what you're looking for match. So to bring us to a close here, I want to remind you, you're doing hard work. Estrangement is not easy. It It is a roller coaster of emotion, and I want you to know you're not alone. Be brave, be kind to yourself, and tune in again so you hear other voices. Come join us in some of our services so you are not alone. There's nothing to be embarrassed about. We all have circumstances that we wish weren't the case and that we would do over if we could. So no shame, no judgment. Join us when you can. We'd love to hear from you. Remember, Janet at jesteinkamp.com. I do answer my email, and I'd love to hear from you. Take care.